deposited. Precipitation we are going to see is deposited. It comes down, it becomes heavy and comes down from the solution. Main function is mainly is the agglutination. So how it works is just chapter. See, this is the antigen. So how it works? Neutralization. What it called? All of them mask the antibody, the immunoglobulin. They binds against the dangerous parts and neutralize it. Agglutination is making the clump. One immunoglobulin is attaching too many. Here, lots of immunoglobulin is binding to one foreign foreign material or the bacteria or virus or pathogen and neutralizes it by exotoxin, whatever they secrete. And here, one antibody is binding with the couple of your pathogens or foreign materials. Precipitation when in interaction with this one and get clumped. And this is complement protein, how they pass through the area. These are not needed to learn, just is there. So I just told you how to do that. Okay. So now we have learned there is cell-mediated immune response and humoral response. So cellular mediated response, let me see what they say. Antigens must be presented by macrophages by an immunocompetent T cells. T cells molecular non-safe and cell double recognition after antigen clones from. So just to know from here, only the macrophages can do the C mediated, we call cellular mediated immune response, we call the cell mediated immune response, or C mediated immune response is by macrophages from the T cell. By the macrophages to make a immunopotent the T cell. That's all. You doesn't need anything more. These are complicated. What is structures? There are so many. No need. So these you can know there are different types of T cells. T cells is one of the kind of lymphocytes. Now T cells, couple of different types of T cells has, and their roles are different. Cytotoxics, or it's called the killer T cells. They specialized in killing infected cells. Who kill the cells is called the cell-mediated response. So specialized in killing infected cells. What they does, I already told you, they insert it. They put like injection in the infected cell, like the cancer cell or any infected, any foreign or what is the harmful cell. These T cells, what they does, they insert some toxin. It's another name of the perforin. And there is another kind of T cells recruit other cells to fight the invaders. So they cannot do by oneself. So they call the other cells. Okay, come on, there is something invader, so we have to kill it. So they help to recruit other T cells or the B cells to help. So they can interact directly with the beta cells too, because they are the helper T cells. This is one kind of cytotoxic T cells. This is the invader. So they are binding each other. Then see, they are putting some toxin Releasing the toxin is making the perforin, and then ultimately it's killing. This is the perforin pore, and they put the perforin. So it's continuing there here, except the helper T cells. We have regulatory T cells. What they does, they releases chemicals to suppress the activity and B T and B cells. So when they also need the regulatory T cells, right? Once it started, the unruling production of antibody the can started. Now somebody has to stop the activity of the T cells when there is no infection. Does that? There are regulatory T cells. When everything is done and T cells and B cells they did that job, they attack the invader, then they release chemicals. The regulatory T cells now come in front in the stage, and here they releases chemicals to suppress the activity of T cells and B cells. These are all T and B cells, mean beta and T lymphocytes, and then stop the immune response to prevent uncontrolled activity. And some of them turn into the memory cells. Okay, these are important. The organ transplant and rejection is totally dependent upon the immunocompromised or immune match. So, what are the different grafts? We have five major types of grafts. Autografts. When tissue planted from one side to the another side of the same person. Say they are taking the somebody needs the bypass surgery. So from the same person, they are taking one vein or artery from leg or thigh or anywhere and putting in your heart for bypass surgery. So that is from the same person when the tissue taking is from one place and putting in the other place is called the auto. Auto means cells. Iso. Iso means tissue grafts from identical person. Who can be identical person? Mainly the identical twins are the identical person. They are coming from the same mom and dad, so generally everything is same, the twins. What is the allograft? When we are taking from the unrelated person, kidney transplant, lung transplant, heart transplant, liver transplant, not always we can do from the same person. So we have to depend up from the donor. So the donor is the another unrelated person, that is called the allograft, unrelated person. Okay, it's not any relation, not any blood relation or anything. So it's from the unrelated person is the allograft. And that is the last one is the xenograft. When a tissue take from a different animal species. Sometimes it happen, it takes from the chimpanzee or monkey or any
Pig.
any any animal species which is very close to human being. So isograft and autografts are ideal donors, less chance of rejection, extremely less chance of rejection. Xenografts are never successful because it doesn't match. It is coming from the animal species on a totally different species.
What
It
about when they do the heart valve from the pigs? Those are successful.
yeah, depending upon xenografts is a big one. It's a small part of the valve, not the whole organ.
No. Yeah, they did a pig heart transplant, I think like 2 years ago. I think the guy lasted like 6 months. So yeah.
Yeah,
But
so it's not ever successful. It started, but it didn't work it out. Yeah. So allografts are, but these are research always try to do, always you cannot, so that you can get the some specific donors. Maybe they can do from the chimpanzee or very close, maybe they can do that. Nobody knows. That is the research. And allografts are also successful because they, before doing that, they do a very closer tissue match. That's the compatibility test. Anyone has any idea where do you also need the check the immune system for in general knowledge? The antigen antibody reaction is very important. Not for the operation or anything, just for sometimes very related to blood. I just can give you the cue.
The cross-matching
Blood transfusion. Yeah,
blood transfusion.
yeah. We need to check the blood grouping. What is blood grouping? That is the immuno. What is we have the that is also depending upon that is also depending upon the immunoglobulin which is present in the blood surface versus the antigen surface, and we check we are going to read the one AB group, ABO group, and Rh positive and negative. So that is also is in general very common use for doing the blood transfusion when there is a low hemoglobin or low erythrocytes or low blood cells. So now different disorders related to immunity. Obviously allergy. Allergy means hypersensitivity. Abnormal vigorous immune response. What type of allergies? Immediate hypersensitivity. It released by the histamine from the IgE binding site to mast cells. So here the IgE comes in picture. IgE is responsible, or IgE release histamine to act on the immediate allergy site. So immediate hypersensitivity is released by the IgE through the releasing of histamine. So reactions begin with seconds of contact with the allergen. What is anaphylactic shock? This is very immediate. Allergic reaction is very dangerous because sometimes it can lead to death if it cannot be treated with the epinephrine hormone immediately. What is dangerous and systemic response is the anaphylactic shock. But there is some delayed hypersensitivity, means something has bite you or something has happened, goes inside, is not immediate, but it ultimately you can saw the symptoms. You can see the hives, you may see the allergies, you can see the rash, you may see the inflammation. So how it happens? It gets by the release of the lymphokines from activated. The helper T cells comes here. Delayed hypersensitivity by the release of lymphokines. How you remember? Helper T cells is a lymphocyte. So by the activated helper T cells, they release the lymphokines and acts on the site of the allergy. So symptoms usually appear after 1 to 3 days with contact with the antigen. That's why called the delayed reaction. These are the pictures. You can look at that, how it binds slowly, then is coming, releasing Ig antibodies, releasing histamine, and then ultimately invading. Now, what you mean by immunodeficiency? When the production or function of any immune cells or complement is abnormal. It's not working properly. It cannot attack the antigen either very low concentration or defective production or the structures are different. It's not compatible to combat the threat of the invader. So it can be congenital or acquired. Sometimes it is comes from the genetics, which is deficient or abnormal, immunodeficient, they are deficient. But we have acquired. When you got the AIDS, you became immunocompromised. We call the immunocompromised, which is the immunodeficient person. So when you got the HIV, all your immune system become very weakened. So not only you killed by the HIV virus, actually your body becomes so much weak in immune response that anything can catch. Pneumonia, diarrhea, any fever, anything, any flu, anything. So that's why they have to be very careful. They cannot mix with other people who has everybody has some infection. Then only can they live longer. Otherwise, they are getting sick for nothing. Now, so this is important. What do you mean by immunodeficiency? Now, autoimmune disease. Auto means self. When your own immune system cannot different which is self and which is non-self, means which is your own protein or own body chemical versus which is coming from the invader. So what if they cannot distinguish? They will think, they are confused, and they can start interacting with your own body cells, own body proteins. So what will happen? Your body is getting damaged because the cells, the proteins, what you need for your functioning the bodies, those are by mistaken due to the autoimmune problem, they are getting destroyed. So the body produces antibodies and sensitized T symbolize that attack its own tissue. What are the this is important. What are some examples of autoimmune disease? Multiple sclerosis. It is related to the brain. There are some region in the brain is called the white matter and you know the spinal cord. These are destroyed. This is the multiple sclerosis, one of the autoimmune disease. It is related to your brain, spinal cord and brain. You doesn't need to remember the white matter, but multiple sclerosis is related to the brain and spinal cord. Those are destroyed. Myasthenia gravis, they impairs the communication between the nerves and skeletal muscle. What is going to be the problem? Movement problem. Because the communication has been destroyed or impairs. Diabetes mellitus. We all learned that the digestive system in the pancreas, beta cells which produce insulin. This autoimmune disease, diabetes, they destroy the pancreatic beta cells. So what is happening in the body if the pancreatic beta cells is they attack that or destroy the pancreatic beta cells? Your body cannot produce insulin, and ultimately you are going to lead to your body is going to have high blood sugar and you are going to be diabetic patient. That is the type 1 diabetes mellitus. That is the genital. Sorry, genetical.
Genetics.
Genetical. It's from the genetics. There is examples continued. This each one autoimmune disease is very important. Anyone can come in questions. Rheumatoid arthritis, we already discussed, it destroys the joints. What is systemic lupus erythematosus? Is called the SLE. Systemic lupus erythematosus. It's a long word. Break it and you can pronounce it. This is a problem. It can affect kidney, heart, lung, skin, everywhere. And also there is another autoimmune disease of the kidney. It's called the glomerulonephritis. Glomerulus is part of the kidney where the actual filtration of the filtration unit is coming at, and then nephritis is related to nephritis in the inflammation of the kidney, right? Nephritis. So it's impairment of renal function. This is not going to come. This is not going to come. Okay, this is the last one. So, developmental aspects of lymphatic system and body defense. Generally, only thymus or spleen, these two organs, develop during the development inside the mom's fetus. But the other lymphoid organs are poorly, these are, sorry, the other lymphoid organs are poorly developed before birth. A newborn has no functioning lymphocytes at the birth. So that's why they are very exposed to disease. That's why when the newborn comes, you have to protect and kind, and slowly they get exposure and they build their immunity. So a newborn has no functioning lymphocytes at the birth. Only passive immunity. Only passive immunity is from the, you remember we talked about the active and passive immunity. Passive immunity when the immunoglobulin passing from moms to fetus. So only passive immunity from the mother. If lymphatics are removed or lost, severe edema results, right? If the total lymphatic system, that is called the lymphatics because it's actually drained out the blood also, in addition to the body defense. So that's why removal of loss, severe edema results, but vessels grow back in time, slowly. That's why when the baby born, you can see they are full of fluid because they doesn't develop the proper lymphatic system, and slowly it's dried up because slowly they develop the lymphatic system and slowly it started clearing up. So this one is done. Okay, so
So as I was saying, ever since I switched to Xperia, I felt empowered. Like I can study anytime, anywhere. And for the first time, I really
Let's say you're at the airport. You're waiting in line to get through security. You're in your socks, in public, and you're wrestling with those plastic bins, and people are yelling at you about dumping liquids and taking your laptop out of your bag. But even with a certain amount of chaos, the line moves pretty quickly. I mean, it should, theoretically, because really everyone has the same goal, to get to where they need to be. Now, you probably think at this point that I'm setting you up to talk about stress or anxiety or something, but I am not. Instead, I want you to imagine that security line is being like your blood, moving through your high-pressured circulatory system. And you, my friend, are not just some impatient traveler in a hurry to catch the next plane to Seattle. You are a bit of blood plasma. And the biggest concern of everyone in your queue is just to get delivered to their destination. But the problem with rushing stuff through a blood vessel or through a security line is that if it moves too fast, you run the risk that something bad might get through. So in the case of the line at the airport, every now and then, the security people funnel some random folks over to a slower line for a full pat down and a bag check. And that is kind of what your lymphatic system does. It takes up some extra fluid, and while it's ultimately helping it get to its destination, it runs a background check to make sure it's legit. It may not be as well known as some of your other more popular organ systems, but your lymphatic system quietly plays a vital supporting role to both your cardiovascular and immune systems. For one thing, it maintains your homeostasis by eventually returning most of the fluid that has been diverted back into your blood. Which is good, because if it didn't, your ankles would swell up like balloons, your lungs would fill with fluid, and your blood volume and pressure would drop to the point where your body would just give up and you would die. But the lymphatic system isn't just another security line. It also has a series of checkpoints that are staffed by special security officers that have the ability to take care of small infections on the spot. Or if they really don't like the looks of what they've found, they can alert the whole immune system to take it down. So for keeping your blood volume levels where they need to be, for keeping you from collapsing from low blood pressure, and for preventing you from dying from a staph infection every time you scrape your elbow, you have to thank the unsung hero of your anatomy, your lymphatic system. Structurally speaking, your lymphatic system consists of three main parts. The first is just your lymph. It's a watery fluid that flows through your lymphatic system. Much of your lymph starts out as blood plasma that gets forced out of your capillaries, way down in the capillary beds, where the leakage helps the exchange of nutrients and gases between the blood and the capillaries and the hungry cells in your tissues. The blood capillaries reabsorb some of the fluid, but a lot gets left behind. So much of the rest of your lymphatic system works to soak it up and get it back to where it needs to go, inspecting it along the way. For example, you have a network of lymphatic vessels that help reabsorb the fluid at about 600 or 700 lymph nodes, which are basically checkpoints that monitor and cleanse lymph as it filters through. Then there are special lymphoid organs like the spleen, thymus, adenoids, and tonsils, as well as other lymphoid tissues throughout the body. Some of these organs and tissues house special defensive cells of the immune system to fight infection by gobbling up bacteria and other harmful antigens, all of which we'll get a lot more into in upcoming lessons. Others, like the thymus and spleen, provide a nursery for maturing immune cells called lymphocytes. But to understand the special supporting role that your lymphatic system plays in your body, let's start with its origins in the capillary beds of your circulatory system. You'll recall that these beds are where the capillaries carry blood from your arterioles and your arteries before that, and feed blood into your venules and eventually your veins. This is where the transfer of nutrients and waste takes place, as blood pressures force plasma out of the arterial end of the capillaries and into the interstitial fluid between the cells of whatever tissue you happen to be in. And most of that fluid gets drawn right back into the capillaries on the venous end, thanks to osmotic pressure. But some is left behind. Of the 20 liters a day that's forced through the arteriolar end of all the capillaries all over your body, only 17 liters is taken back up by the venous end. Those other 3 liters? That becomes your lymph. It's almost immediately picked up by nearby lymphatic capillaries that wind their way in and among the blood capillaries, and they're really well suited for their job. Lymphatic capillaries are made of loosely overlapping endothelial cells that look kind of like roofing shingles, forming little flap-like valves that only open in one direction. So when the pressure in the interstitial space becomes greater than the pressure inside the lymphatic capillary, the flaps push open and take in fluid to relieve the pressure. Once the fluid is inside a lymphatic capillary, we can officially call it lymph. lymph. Then it flows through successively larger lymphatic vessels to collecting vessels and then the larger trunks, and finally into one of two big ducts that feed back into the lowest pressure area of the circulatory system. The right lymphatic duct drains all the lymph collected from the upper right area of the torso, as well as the right arm and the right sides of the head and thorax, and feeds them all into the internal jugular vein. The larger thoracic duct takes lymph from the rest of the body and dumps it into the subclavian vein. Overall, these vessels work a lot like your veins do. They operate under very low pressure, have a series of valves that prevent backflow, and are helped along a bit by smooth muscle in the vessel walls that keep the fluid moving. Okay, so the lymphatic system takes extra fluid that's squeezed out of the blood capillaries and basically mops it up. That sounds handy, but as a living thing that wants to stay alive, what's in it for you exactly? Well, remember, we're talking about recovering 3 liters of blood fluid per day. That's more than half your total blood volume. If that weren't returned to your circulatory system, you'd be looking at a serious drop in blood pressure and little to no oxygen delivery or waste pickup. Plus, any blockage in the lymph system, like from a tumor that obstructs one of your vessels, can be really dangerous, resulting in edema or swelling that can constrain blood flow and lead to serious complications. And finally, don't forget that your lymph also plays a key role in the function of your immune system. Say you scrape your elbow and some bad stuff, like the Staphylococcus bacteria that's covering your entire body right now, infiltrates some of the loose areolar connective tissue under your skin. Since that tissue is full of interstitial fluid that drains into your lymphatics, which ultimately drain to your heart, you're gonna want to vanquish those bad guys before they have a chance to wreak any havoc. Whatever will you do? Well, this is where your lymph nodes come in. Your body's main lymphoid organs, the lymph nodes, are where your lymph gets close and regular inspection by its resident immune cells, lymphocytes. Depending on what kind of troublemaker they find in the fluid, the lymphocytes might trigger the release of resident macrophages to attack unwanted microorganisms, or they might activate the general immune system outside of the node if they need extra support. The details of how that happens we will get to next time, but for now, just understand that lymphocytes are found in and mature in the loose reticular connective tissue that makes up a large part of the nodes and most of your other lymphoid organs. Now, if a node is overwhelmed by whatever invader it's trying to quell, it may become inflamed. You can actually feel some of your nodes if you poke around the sides of your neck. They feel like little bumps. Little bumps. Yeah, there they are. And noticeably enlarged lymph nodes are often an early diagnostic sign of disease or infection, which is why doctors are always feeling around under your jawline during checkups. But your lymph nodes aren't the system's only checkpoints. You've also got a few special outposts placed at strategic entry points to particularly sensitive tissues, like those in the respiratory and digestive tracts. These are called mucosa-associated lymphoid tissues, or MALTs, because they can be found in mucous membranes around the body outside of the lymphatic vessels. Your tonsils are some of the largest collections of these tissues, which together form a ring around the entrance of the pharynx. There, they can inspect everything you eat and breathe and try to remove any pathogens before they enter the GI tract or lungs. It's a pretty big job, actually, which is why sore throats and swollen tonsils are a common sign of a cold or other infection. Another collection of malts, called Peyer's patches, are in the distal portion of the small intestine, providing another checkpoint along the GI tract. And contrary to popular myth, your appendix is not useless because it too contains a bunch of lymphoid tissue and is conveniently located where it can destroy any remaining bacteria before it can breach the intestinal wall during absorption. Exactly how your lymph and immune cells detect and destroy the unwanted visitors that might otherwise kill you is what we're going to be talking about for the remainder of this course. But for now, you learned how your unsung lymphatic system supports cardiovascular function by collecting, filtering, and returning interstitial fluid back into the bloodstream via a system of lymphatic vessels. We also talked about the system's major role in fighting off infection and how lymph nodes and other lymphoid organs and MALT areas house antigen-attacking lymphocytes that provide crucial support to the immune system. Thank you to our headmaster of learning, Linnea Boyev, and thank you to
So now we are going to learn the cardiovascular system. Okay. Video. So cardiovascular means cardio means heart and vascular system means vessels. So it's combining making the cardiovascular system. What is that? It's a closed system of the heart and blood vessels. That's the cardiovascular system. What the heart does? It pumps blood and blood vessels is the carrier. They allow blood to circulate to all parts of the body. These are the main functions of the cardiovascular system important. Deliver oxygen and nutrients to cells and tissues. They carry the oxygen and nutrients and then delivered to all cells and tissues. And also remove carbon dioxide and waste products. That's a part of the excretory function. We remove the carbon dioxide and the waste products from the cells and tissues. So carbon dioxide through the lungs and other waste products through the kidney. Heart location important. Thorax between the lungs in the inferior mediastinum. What is the location? Is in the thorax between the lungs, so in middle portion, and in the inferior mediastinum, that is the position. What is the orientation? How it placed? The apex directs towards the hip, that is the tip of the heart. It's called the apex. It's the left hip. So always is pointed, the apex of the heart is always pointed towards the left hip. And the base, that is the upper portion, is toward the right shoulder. So it's slightly angled, not straight. So that's why when you get the right chest pain, that is more worried than the left chest pain. And how is our heart size? Can you imagine? It's size of your fist. So small, but doing what type of job? Restless, no vacation, no sleep hours, nothing, no up, 365 days, 24 hours non-stop doing the job. And only the time, slowly it became damaged, like the everything, all the machinery does. And one day, when it functions does, it stops. So the position, this is the heart. This is called the apex of the heart, which is pointing towards the left hip. And this is the base, that is the top portion of the heart. This is towards the right shoulder. Very important anytime the questions come. This is the mid-sternal line. This is the two lungs. So it's in the middle, but towards the alignment is like this. So this is the heart, this is the left lung, this is the right lung, and this is called the mediastinum, means sternum in the middle portion behind the sternum. So it's called the mediastinum. So see, this is the how it sits, apex of the heart towards the left hip, base of the heart towards the right shoulder. This is the left lung, this is the right lung, and how heart sits like this. So there are lots of parts in the heart itself. So we are going to talk slowly. You doesn't have to remember all of the names. Before used to come the labeling. I don't know. Sometimes as for the labeling, you have to know which is the right atrium, which is the left atrium, which is the right ventricle, which is the left ventricle, which is the main aorta, which is the superior vena cava, what is the inferior vena cava, what is the left artery, left pulmonary artery, right pulmonary artery, and then there will be valves inside. Okay, so sometimes you have to, once you learn, you have to remember and practice and labeling the diagram. I don't know whether it comes now, But before this come, they will give you the diagrams and the arrows, and you have to label it. So what is the pericardium? Peri means which is surrounding. So pericardium is a doubled wall sac. We have already learned. So it's a fibrous pericardium is loose and superficial. Serous membrane is deep to the fibrous pericardium and composed of two layers. It has visceral pericardium, which is next to heart, also known as the epicardium. So where is this one? So you can see it is closed by a sac, differentiate from the lungs. So this is called the pericardium. Okay, so the inner one, it is double layered. It's not showing it here. It's a double layer or triple layer. So what is happening? There is in between that there is a fluid. This is called the pericardium. This pericardium, when enlarged, there are outer and inner. The inner one is covering the heart. That is called the epicardium. And there is the outer one. So pericardium is surrounding the heart, and epicardium is the outer layer of the heart. And there is a fluid in between, which is called the pericardial fluid, which helps the heart to prevent from the friction. So serous membrane is deep to the fibrous pericardium and composed of two layers. Visceral pericardium, which is next to heart, called the epicardium, and parietal pericardium, outer layer. That's the inner surface of the fibrous pericardium. And serous fluid fills the space between the layers of the pericardium is called the pericardial fluid. So how it looks like. So this is the pericardium. Okay. So now if we do this like this is too much little bit. This is the inner layer, middle layer, the myocardium. You can see the layer. So there is one layer which is covering the heart, close to the heart, that is called the epicardium. And what is the outside is called the parietal layer or pericardium, parietal or serous. Either is the parietal layer or serous membrane. And this is the pericardial cavity which is filled with the fluid. And then the heart has two other layers, the myocardium, that is the muscular layer of the heart, and then the endocardium, which is mainly lining the atrium or ventricles. So pericardium, sometimes the questions come, there is the option, what are the outer layer of the heart coverings? If there is a pericardium, myocardium, endocardium, it can be pericardium. But if there is an option, epicardium, myocardium, endocardium, the first answer is going to be the epicardium, because epicardium is basically closed, closely next to heart. So epi, myo, endo. Endo means within, inside. Myo means in between muscle layers. And there is the epi means outside epicardium. And epicardium, that is the part of the pericardium. So we have already three layers. Heart walls is composed of three layers. Is the epicardium, outside layer. This layer is the visceral pericardium. We already discussed that one. Is made up of connective tissue so that it connect with the other parts. And then myocardium is the middle layer, mostly cardiac muscles, and endocardium is the inner layer, which is made of the cells called the endothelium. Endo means inside. So these are the same structure. You can see that one. Then, okay, let us go to the next slide. So what are the heart chambers? From the beginning, from school, childhood, whenever you go through the school, we know the heart had four chambers, right? And it has divided into right and left. So we have four chambers. What are the main? Atria and ventricles. We have two atria and two ventricles. So when plural, when you are talking about the plural form of this atria, and when it's single is called the atrium.
Atrium.
atrium. Be careful, okay? So atrias are the receiving chambers. They receive the blood, either deoxygenated or oxygenated. So these are the receiving atria are the receiving chambers, and ventricles are the discharging chambers. They discharge from the heart to the specific area where needs to be done. So basically, the right atrium always collect the deoxygenated blood. That is the blood when after it travels through whole body, it comes to the right atrium. Deoxygenated blood. It's going to come again, but this is very important. This is going to come in questions anytime. Left atrium always receives the oxygenated blood. It is from the lungs. Left atrium receives the blood, which is called oxygenated. Gets from the blood after the gaseous exchange or the purification. And ventricles, what they does? The discharge. Right atrium get the blood and left atrium get the blood. Then either it has to send for purification or the blood has to send for the circulation in the body. Who does this job? Ventricles. Questions come: receiving chambers of the heart, discharge chamber of the heart. So you have to remember receiving chambers, atria, discharge chambers, ventricle. The right ventricles get the deoxygenated blood from the right atria and send it to the lungs for gaseous exchange, so the deoxygenated blood can get oxygenated. And from the lungs, after purification, the fully oxygenated blood comes to the left atrium, and then from left atrium, blood comes to the left ventricle, and the left ventricle pushes the blood out to get circulated throughout the whole body. So you have to keep it in mind, you have to keep it image in your brain printed how it works. So this is the left ventricle, this is the right ventricle, this is the right atrium, this is the left atrium. And then we are going to talk about the associated structure. So how it looks like if you cut in the cross section. This is the right ventricle, this is the right atrium, this is the left atrium, this is the left ventricle. So now we are telling that there are 4 chambers, 2 atria, 2 ventricle. How it happens? It needs to be separated between the right and left, right? So do that. There is a septum or the division. So interventricular septum separates the 2 ventricles. So this is the interventricular septum. That's the barrier. This divides the 2 ventricles, to right and left ventricle. Same thing in atrium. Inside there is a division that is called the interatrial septum, which separates the 2 atria. So you can see this was interventricular septum, which separates the left versus right ventricle. The atrium, we cannot see it in the middle, so it's also separated the left and right atria. So we have 2 types of circulation. Heart do the circulation, right? We have 2 types of circulation: systemic circulation and pulmonary circulation. What is systemic circulation? When the blood flows from the left side of the heart, I told you this carries the oxygenated blood from the left side of the heart throughout the body, tissue, and cells, and back to the right side of the heart. That is the systemic circulation. So oxygenated blood from the left side is start travels throughout the body, then get exchange and everything in the capillaries, like where the lymph vessels give delivering the oxygen, nutrients, everything, and taking the back waste things, carbon dioxide, all other waste products, and then again being deoxygenated and taking the waste products, this coming back to the other side, the right side of the heart. This is the total cycle, the circulation is called the systemic circulation. You have another circulation, is the pulmonary circulation. Pulmonary circulation is responsible for the purification of the, or taking the carbon dioxide out and get oxygenated. So here the deoxygenated blood comes in the lungs from the right ventricle. This each step is very important. First, all the deoxygenated blood comes to the right atrium. From the right atrium, we are going to learn the different valves. The blood comes to the right ventricle. Right ventricle then send the blood to the lung through the pulmonary artery that we are going to, only the pulmonary artery, note it down, who carries the deoxygenated blood. In general, all the arteries carry the oxygenated blood and all the veins carry the deoxygenated blood. We are going to discuss again, but from the right ventricle, blood goes to the lung. That is called the pulmonary. Pulmonary means lung. And then it's become purified. And then from there, after gaseous exchange, up the blood gets oxygenated. The blood comes back to the left atrium. So it's cell pulmonary circulation. Blood flows from the right side of the heart to the lungs and back to the left side of the heart after getting circulating through the lungs, becoming oxygenated and get rid of the carbon dioxide. Clear? Okay, good. So this is the circulation pictures. This is the lung.
Miss?
Yes.
Sorry. The pulmonary, can you repeat? You were saying that only the primary carries something. I didn't get all of that.
Pulmonary artery.
Artery. Okay.
Pulmonary artery only carries the deoxygenated blood, and in contrast, pulmonary vein carries the oxygenated blood. So pulmonary artery goes from, after discharging from the right ventricle to the lungs.
Okay. Thank
Okay.
you.
We are going to repeat it again, so don't worry. Yeah, but I am giving you the points where the questions come, where the main important things. So basically, we talked about, you have two types of circulation. One is the heart and one is the pulmonary circulation. So heart, deoxygenated blood comes here. That is the right atrium. From right atrium, it goes to the right ventricle. From the right ventricle, this is the pulmonary. From the right ventricle, pulmonary artery. See, the blue one is deoxygenated blood. It goes to the lungs. Get gaseous exchange. They become purified and then it's become oxygenated. This oxygenated blood comes through the pulmonary vein. Pulmonary vein, which carries the oxygenated blood, and then it comes to the left atrium. Then from left atrium, it goes to the left ventricle, and then from there is go through the aorta, it goes to the general circulation, total sending all the branches and everything everywhere in the all cells, all organs, on tissues. Then gaseous exchange, everything done. Then carrying the waste products and the deoxygenated blood and again became to the right atrium. So this right atrium and left atrium are the receiving chambers because they are getting is the deoxygenated blood. Right atrium and oxygenated blood from the lungs is coming to the left atrium, receiving chambers. And these two ventricles are the discharge chambers because this right ventricle, when the blood gets from the right atrium, it's sending to the lung for purification, and this left ventricle, when they get the oxygenated blood, it's pushing out blood to the whole body system or in the systemic circulation. Question, any clear, any confusion between the systemic and pulmonary circulation? Very important. What is the receiving chambers? What is the discharge chamber? How many chambers the heart has? What is systemic circulation? What is Pulmonary circulation, clear? Not clear?
Somehow, ma'am, it's clear, but we have practice again.
Yes.
Practice, practice.
Obviously, you have to read it. It's not like that.
Yes.
Whatever, because the picture in my eyes, so I can close my eyes and describe the whole system. When you will do that point, it's going to be easy. I am giving you the focus point, which you are going to focus, which is very important. This system, cardiovascular system, blood and other things is very important also for our profession. Anatomy we are learning, this one is very important for the edema things, lymphatic system. This is important. So whatever the mainly, but this structure, this cardiovascular is very important because we are dealing with the blood. Other systems, for the urinary, you are going to learn the whole urinary system, but you are only going to deal with the urine. So you doesn't need to remember so much except your exam. But this one, yeah, I am not telling the hard valves, those structures, but yeah, at least you should know the what is the blood, what is works, what it carries, how it discharge. Okay. So heart has valves because it has to send the blood. So this one has some blood between right atrium and right ventricle. At the same time, there are some valves, and also there is valve from the right ventricle to the before going to the lung in the pulmonary, this junction. You can see these valves are flat, these are the valves. Okay. At the same time, there is a valve when it's coming from the left atrium to the left ventricle, and another valve when it's going from left ventricle to the aorta. So let us see what are the name of the different types of valves. And all valves work in one direction. Once it's pressure released, then it closes. So heart valves, what is their function? Allow blood to flow only one direction to prevent the back flow. If your heart valve is damaged, backflow, there is a mix of oxygen and deoxygenated blood, then you feel respiratory problem, lack of oxygen. So that time you need the valve replacement. So it can be done for any reasons. Okay, so allow heart valves, the main function of the heart valve is to allow blood flow in one direction. We have 4 valves as I showed you in the diagram, which is called the atrioventricular valve. What is atrioventricular means? The valves which are present in between the atria and ventricle. So atrium and ventricles, so atrioventricular valves. Now you understand the terminology, right? Those are called the AV valves. So that means what I told is between atria and ventricle. We have 2 valves, bicapsid. What is the another name? Is the mitral valve. Each one is important. Bicapsid and tricapsid. Bicapsid is the mitral, which on the left side of the heart. So between the left atrium and left ventricle. And tricapsid. Why is called capsid? Because there are flaps. There are 2 flaps or 3 flaps. Depending upon that, they have the names. The bicapsid. Another name of bicapsid valve is mitral valve. Place in between the left atrium and left ventricle, left side. And another atrioventricular valve, the name is tricapsid because it is kind of valve, but it has the 3 flap. Tricapsid valve, and it is present on the right side. Right side means what is going? This is the atrioventricular valve. So it's going to be in between right atrium and right ventricle. Clear about the atrioventricular valves? Then we have the semilunar valves. These are the structure like the half moon shaped. That's why it's called the semilunar valves. Those are present between the ventricles and artery or vein. We have the pulmonary semilunar valve and aortic semilunar valve. Okay, so let us see what is which one. See, you can see the right side. This is the atrium. This is the ventricle. This is called the tricapsid valve. You can see these are called the chordae tendon. So this has three tendons. That's called the tricapsid valve. And this one in the left side, between the left atrium and the left ventricle, it has the bicapsid or mitral valve. It has two chordae tendon. So this is the, and here we have the, is called the, I told you, the half moon shaped, when from the right ventricle is going to the right pulmonary artery, there is another valve. This is called the pulmonary semilunar valve because it's going to the lungs. That's why it's called the pulmonary semilunar valve. At the same time, when is this from the left ventricle, blood is sending to the main aorta. That's its name. This is the moon-shaped gland. It's semilunar. This is called the aortic semilunar valve. Semilune means it's half moon-shaped structure. Both of them. One is pulmonary because it's going to the lungs. That is the pulmonary semilunar valves. And another is the aortic semilunar valve because it's going to the aorta. So that is the aortic semilunar valve. So four valves. Two are atrioventricular, tricapsid and bicapsid, and two are semilunar valve, which is going to the pulmonary circulation or pulmonary vein or aorta, mainly in the circulation. So pulmonary semilunar valve and aortic semilunar valve. So what the AV, atrioventricular valves, does, anchored in place by chordae tendon, that is called the heartstrings that I told you. So they are here and they are attached with the chordae tendon, is called kind of string-like structure. Open during heart relaxation and close during ventricular contraction. So these valves, the AV valves, opens when heart do the relaxation and close during ventricular contraction. When the atria relax, it send the blood here, ventricle relax, and they again closed back. This valve closed. Semilunar valves is the opposite. When it closed, one set when is getting the blood, another valve has to be closed. So when the AV valves open, semilunar valve closed. When the semilunar valve opens, AV valve closed, because so that there will be no backflow. So semilunar valve closed during heart relaxation but open during ventricular contraction. So now come to the cardiac circulation. Heart sends the blood to everywhere, but heart itself needs its circulation. Otherwise, how is going to get the energy to function, right? So what is own heart's own circulatory system is called the cardiac circulation. So blood in the heart chambers does not rise myocardium. Inside the heart chambers, it cannot go to the myocardium of the heart to give the nutrients and other things. For that, it needs its own circulation system. So heart had its own nourishing circulatory system, which is consist of coronary arteries. You guys know what is the coronary block, cardiac veins, coronary sinus. What is coronary arteries? The branch from the aorta to the supply of the heart muscle with oxygenated blood. So from the left ventricle, when the blood is going to the aorta, the main trunk from where the all circulation branches, and from there one artery comes and supply the heart muscles with the oxygenated blood. That is called the coronary artery. Cardiac veins, same thing. When the coronary artery supplies the heart muscles and heart region. So at the same time, the vein originates from there and send the it drains the myocardium of blood. What is coronary sinus? A large vein on the posterior of the heart receives blood from the cardiac veins. So from all parts of the cardiac veins, it receives blood and dump it there, and then it send it for circulation. That is the coronary sinus. So first blood empties in the right atrium via the coronary sinus. So you have the coronary sinus back. We are going to show it later, and from there, blood actually comes to the right atrium. So you can see from the aorta.
Mom,
Yes.
I'm sorry. Let's go for a break.
Yeah.
Give me some time.
Just give me complete instead of going to the arteries. Just
Okay.
okay. So that's why I'm just completing the heart, and then we are going to the artery. Okay. So we have the heart. Thank you for reminding me. When I sometimes speak, I forgot. But once you start one something, so just let's complete that one. Okay.
Sure.
Thank you. Thank you
Okay.
very much. I'm sorry for your patience. I'm sorry, and
Oh, no
thanks for
worries.
your
You've been.
thanks for your patience. Okay.
Yes. Thank you.
Yeah, okay. So we have coronary arteries. So it's coming from there, and then ultimately it's called the common carotid artery is go to the carotid is going to the up. So this is you can see different branches of the heart things is circulating this one. This is the different types of arteries. Any blockage in any artery or any vein can give you heart problem, and because they are supplying the oxygen in the artery and nutrient in the heart muscles. So if there is a deficiency in the oxygen, heart cannot, or the nutrients, heart cannot pump properly. So then you feel breathing, you feel pain, the angina, cardiac pain. So when there is a insufficient oxygen supply, that is, we are going to learn some couple of heart problems. So this is the cardiac, these are the, and then the all this deoxy when she supply the blood and everything, and the deoxygenated blood is carrying out to the venous system. The main vein is the coronary artery. This is the main coronary artery. This is the right coronary artery. Sorry, this is the left coronary artery is coming from the aorta. This aorta is getting blood from the left ventricle oxygenated one, and from there one is the left coronary artery and another is the right coronary artery is going here and circulating the vein. Okay. Thank you. And we are going to talk with the arteries. Next slide. Okay. Thank you.
You're welcome. Enjoy your
Sorry.
coffee.
Sorry for keeping you so long.
That's
No,
okay. Thank you.
it's very interesting. But you've
Okay.
been talking since 9, so yeah.
Thank you.
You deserve the break more than we do.
Thank you for the understanding. Thank you.
Yeah.
Thank you. Thank
The
you.
20 minutes back and
Okay. Yeah.
okay,
Thank you.
Okay. Yeah. Sabana absent. Sabana absent. Okay. Oh my God, where it goes? Planetary physiology. Physiology. 11, 12, 13, 14, 15, inshallah. Vascular system. What about what is that one? Where's the PowerPoint? Okay. So we are starting from where we left. So we have the arteries. What are the main vessels, vessel systems? We have the arteries and veins. What are the main arteries? The name is aorta. So it leaves the left ventricle. What I showed you a couple of pictures. It's the main one from the left ventricle. The oxygenated blood leaves the heart. That's the main aorta. And from the aorta, there will be different branches. And then we have other arteries. What is name? Pulmonary artery. This pulmonary artery, again, it leaves from the right ventricle. What is name pulmonary artery? Because its destination is the lungs. So the artery which is originating from the right atrium and going to the lung is called the pulmonary artery, and this pulmonary artery only carries the deoxygenated blood. Only artery in the whole blood circular system carries the deoxygenated blood. Is carrying the deoxygenated blood from the right atrium to the lungs. Then you have the veins. Veins always carry the deoxygenated blood, except the pulmonary vein that we are going to talk. So we have superior and inferior vena cava. These are the collecting the main veins which all from all the body, when the blood, deoxygenated blood and waste filled blood comes, then they are from the dumped into the two major veins is called the superior and inferior vena cava. From the upper part of the body, from the head, neck, trunk, thorax, all the deoxygenated blood returns to the superior vena cava, and from the downside of the body, the deoxygenated blood returns to the inferior vena cava. And this superior and inferior vena cava, they dumps the or releases the deoxygenated blood to the right atrium. Then we have pulmonary vein. Pulmonary vein, it's originating from the lung, carries the oxygenated blood, and then it is leaving the left atrium. Sorry, the pulmonary vein is leaving the left atrium, and bringing the oxygenated blood to the ventricle. So this is the aorta, main aorta, and then is getting divided into different branches. These are the vena cabas. This is the inferior vena cava, and this is the superior vena cava. This is the right pulmonary artery, which is carrying this one, and the vena cava. So vena cavas are on the back. That is the right and left vena cava. Okay. So how the blood flows through the heart? I already told each step. So from superior and inferior vena cava, dump blood into the right atrium. Then from right atrium through the tricapsid valve, blood travels to the right ventricle. From the right ventricle, blood leaves the heart and then it passes through the pulmonary semilunar valve into the pulmonary trunk, and then pulmonary trunk splits into right and left pulmonary arteries and carry blood to the lungs, because there are two lungs from the both sides. Then oxygen is picked up and carbon dioxide is dropped off by the blood in the lungs, and then the oxygen rich blood returns to the heart through the four pulmonary veins. Oxygen rich blood returns to the heart through the pulmonary veins. Blood enters the left atrium and travels through the bicapsid valve into the left ventricle, and from the left ventricle blood leaves the heart through the aortic semilunar valve and aorta. This is the circulation. Already I showed you, I discussed you. So what is the heart conduction system? How heart functions? Oh my God, they are telling the ECG here. Oh no, but it's going to be generally we just teach this one in the ECG. Anyway, heart conduction system. Now heart pumps. How it heart pumps? What is the from where the heart gets the electrical signal, how it does that? So there are two, there are conduction system. It's called the intrinsic conduct system. It's called the nodal system. So what is that? Heart muscle cells contract without nerve impulse. It's a irregular, continuous way. So heart muscles always contract. That is no non-impulse. That is no, it's actually under hormonal control. So that is no, it's always non-stop beating in a regular way. It's not the arrhythmic. When there is arrhythmic, there is a problem. As the slow rhythm, bradycardia, tachycardia is not bradycardia, both mix, so it's not consistent. So that rhythm makes a problem of the heart problem. But in general, heart muscles always, like the all muscles, they are always contracting in a regular way. This is the nodal system. It's called the intrinsic pathway. And then there are special tissues that set the space, means starts the signaling, the electrical charge. What are the mode? Is called the SA mode. SA mode, another name is the pacemaker, is in the, and it sits on the top of the left side towards the top of the right atrium. It's the SA mode. This one sets out the signal. So it's called the pacemaker of the heart. Then atrioventricular node, that is called the AV node. It sits at the junction of the atria and ventricles. That is called the atrioventricular node. Okay. Then third one is the atrioventricular bundle. The signal, the electrical charge pass one by one through this. That's why it's the atrioventricular bundle is or called the AV bundle, and is another name is bundle of His. It is in the interventricular septum. Is going to the ventricle, starting from the atria, then atrium, right atrium, then from right atrium is going in between the atrium and ventricle, and then is passing to the ventricle, so that the electrical charge can be sent or the electrical signals can be still. Then bundle branches, these are even in the interventricular septum. We saw the septum which divides the ventricles, and then the Purkinje fibers spreads within the ventricular wall muscles, all inside, deep branching, so that the heart can pumps. So see in the here. So this is not inside, it's showing this one inside, is in the outside. Or inside. So this is in the right atrium, the top left corner, sorry, top right corner, it has the pacemaker or called the SA mode, SA node, sinoatrial node. Then we have another node is in the junction between the atrium, right atrium and the ventricles. This is called the AV node. And then from here, one branch come. This is called the bundle of His or atrioventricular bundle. These are all important. Then it divides and going to the left and right is called the bundle branches. Is going to the interventricular septum. And then is getting branches. These are called the Purkinje fibers. They looks like a Purkinje fibers. So basically, first the electrical start stimulates the SA node, then SA node from sends the signal to the left atrium and to the here, and then the electrical circle is passing through from here to there, and this electrical impulse is governing the opening and closing of the valves: tricapsid valve, bicapsid valve, semilunar valve, pulmonary aortic valve. So what I told, contraction is insisted by the SA node. Sequential stimulation occurs at other autorhythmic cells. When stimulates the autorhythmic cells of the heart, which has the intrinsic one, they start controlling force adduct cardiac muscles depolarization in one direction from aorta to ventricles. Depolarization means going signal from one direction from aorta to ventricles. Once SA node starts the heartbeat, impulse, as I showed you the picture, impulse spreads to the AV node, which is in between the atrium and the ventricle. And then what happened? The atria contract. When the atria contract, what happened? The AV node impulse passes through the AV bundle branches and Purkinje fibers. So blood is, when the atria contract, blood comes to the ventricle. Now the blood is ejected from the ventricles to the aorta and pulmonary trunk, and the ventricles contract. So these are the things, whatever the same thing, whatever I told you. So there are a couple of heart related problem. Homeostatic imbalance. What is the heart block? When there is a damage in the AV node, releases from the control of the SA node, results in the slower heart rate. Either is SA mode or the AV node. Damage in the AV node, which is sending the signal from the atrium to the whole heart, basically in the ventricles, and ultimately is a series of reaction, chain of reaction. So heart block is damage AV node, releases them from control of the SA node, result in the slower heart rate as ventricles contract at their own rate, because that time ventricles is not getting any signal from the AV node through the SA node. So they are doing their own that intrinsic control, which is not the force pump. What is ischemia? Lack of adequate oxygen supply to the heart muscle. That is called the ischemia. Fibrillation, a rapid, uncoordinated shuddering of the heart muscle. It's not continuous, it's going locked in a rhythm, it's uncoordinated shuddering. That's the fibrillation. Homeostatic imbalance. You all know tachycardia, rapid heartbeat is over 100 beats per minute. Bradycardia, slow heart rate less than 60 beats per minute. Okay. So heart cycle and heart sounds. So systole means contraction and diastoles mean relaxation, because contraction and relaxation is going on simultaneously. When one contracts, the other relax. When atria contracts, ventricle relax. When ventricle contracts, atria relax. So atria contract simultaneously then atria relax, then ventricle contract. So one systole is contraction, one diastole is relaxation. What is the cardiac cycle means? It's the events of complete heartbeat. Heartbeat, one heartbeat. You doesn't need to know all these steps. It's too complicated. Too complicated. I already told you whatever I told you. Just remember that. That's enough. So how it works? So blood from here through the tricuspid valve to the SA mode is coming here, and then is going there to the lungs. From the lungs is coming. It's called the when. Oh, sorry. When this atria contracts, this tricapsid valves opens, the blood goes in the ventricle, right ventricle. When the blood is going there, then its ventricle starts to generate the pressure, then the tricapsid valve close. And then from here, when the ventricle gives the pressure, this semilunar valve opens to go to the blood in the lung. In the same way, in parallel, what is happening? The blood is coming to the left atrium, and when this left atrium contracts, this bicapsid valve opens, filling the left ventricle, and when the left ventricle is filling, after fill, these valves close the bicapsid, and then after that ventricle contracts, then contraction, open this aortic sublunar valve to go to the aorta. So these things, both same time, both atria contracts and the ventricle relax. And when the atria relax, when the ventricle contracts, the aortic started to relax. So now these are two very important. These questions come. What is the difference between cardiac output, stroke volume, and heart rate? Stroke means one stroke, one contraction, one hit. That's the difference to meaning. Stroke volume means single stroke. How many strokes the heart generally makes per minute? Tell me. Nobody knows? How many beats? How many strokes or beats one heart does per minute?
It ranges from 60 to 100.
Yeah, what is the
75,
normal? 70 to 80 is the normal.
75.
Yeah.
Oh,
70 to 80 is the normal range. Okay. So
okay.
that is the stroke. That is the beat. That is the stroke. So per stroke or per beat, how much blood is pumped by each ventricle is called the stroke volume. So volume of blood pumped by each ventricle in one contraction or beat or each heartbeat. That is the stroke volume. Don't get confused between the stroke volume and cardiac output. Remember, in that way, in mind, stroke means one beat, one stroke. So that is 1 minute. Sorry, per stroke or per beat, how much volume of the blood is pumped out from each ventricle is called the stroke volume. In general, how much it does is 70 ml of blood is pumped out to the left ventricle with each heartbeat. What is then cardiac output? Cardiac output is 1 minute. So in 1 minute, there are normally 70 to 80 beats. So 1 minute, that means total amount of blood pumped by each ventricle in the half of the heart in 1 minute. So if for example, 70 ml is the stroke volume, what is going to be the output, cardiac output, if a patient has a 80 heartbeats per minute? Hello, world. It depends upon তুই রাত্রে কখন খাবি সেই অনুযায়ী তুই যদি 10টায় খাস 10টায় করতে পারিস you can take only the time difference you have to take I think it's 2 to 3 hours max 2 hours in general maximum 3 hours fasting 8 to 10 huh okay okay anyone I said cardiac out means the amount of blood pumped by each side of the ventricle per minute, okay? In 1 minute. The stroke volume is the amount of blood per beat. So if the 70 ml is the stroke volume and a patient has or a person has a heartbeat of 80 beats per minute, what is the going to be the cardiac output? Come on, answer me.
80. 80.
80? 80 beats per minute. What is going to be the cardiac output? How much volume of the blood is going to be pumped out?
5,600.
Yeah,
Same number.
70
80.
times 80.
Yeah.
70 times 80. 70 ml is the stroke volume and heart is beating 80 beats per minute. So in 1 minute, how much volume? Each minute is sending 70 ml blood out. So in 1 minute is going to send it 70 times 80 beats. So 5,600 ml of blood. That means,
Okay. Thank you.
my God. So you can see how much blood per minute one heart is pumping out. Approximately the whole blood,
Yeah,
5
that's a
liters.
lot.
It's a fist of a size of a heart and is pumping out so much blood in per minute. So heart rate is the beats per minute is typically 70. This is very important. I am telling you, cardiac output, stroke volume, they will ask the questions, they will give you the cardiac output sometimes and ask you the stroke volume or from the stroke volume and they are going to give you the what is the normal heart rate and then you have to measure the cardiac output. Normal heartbeat is 75 beats per minute. So this is the calculation. Cardiac output. So
5,200
heart rate, cardiac output is heart rate or the beats per stroke times stroke volume. Beats heart rate is 75 beats per minute and stroke volume is 70. So 5,250 ml per minute. Okay? Whatever I ask you, this is the CO means cardiac output, SV stroke volume, and HR is the heart rate. That is the how much beats per minute. Clear?
Yes.
Okay. How the heart regulates, function regulates. It regulates through the sympathetic nervous system, hormones, exercises, and other things. Sympathetic nervous system comes on crisis when there is kind of low blood pressure. Hormones, what are the main hormones? Epinephrine and thyroxine. These are the two main hormones which controls the heart function. Exercise, it decreases blood volume. So sometimes who are athletes, they have a permanent bradycardia. Okay. So heart regulation, the heart decreased heart rate can be controlled by the parasympathetic nervous system, high blood pressure or volume, or decrease venous return. These are not that important, but you can see the foot exercise. What are there is a chart which can increase, which can decrease, that you have to remember. Now, what is the functions of the vascular system? Transport blood to the tissue and back. Who carries blood away from the heart? You guys should
Arteries.
know arteries and arterioles is in the screen. But from your mind, you can understand arteries are carrying away oxygenated blood except the pulmonary artery. Again, I repeat, carry the oxygenated blood away from the heart towards the whole body. Then exchange between the tissues and blood takes place in the capillary beds, and then after the exchange, deoxygenated and toxic or the waste materials fill blood through venules and veins. They returns to the heart. So blood vessels, we have learned that heart has three layers: epicardium, myocardium, and endocardium. Similarly, these blood vessels has also three layers. It's called the tunica intima, which is the closed one, tunica media is the muscle one, and tunica externa, mostly fibers or connective tissue, which is the outside covering. So again, it has the outside, inside, and middle and inside. So outside externa, fibrous connective tissue, keep the strength of the vessels. Then we have the tunic media, that is the smooth muscle cells, which is controlled by the sympathetic nervous system because it's autonomic. We cannot control it. So that is the sympathetic nervous system. And the inner layer is the soft and is lined by the endothelium. So different layers of that, and inside this is the lumen or artery from where the blood flows. In generally, arteries have a thicker tunic media than veins because it has to pump the blood down. Capillaries are only one cell layer, and you doesn't need to know. Veins has thinner tunic media than arteries. Veins, this is important. Veins has valves to prevent blood flow of the blood. Lumen of the veins are larger than the arteries because see, the lumens is larger than the arteries. It has less your this structure. What is called this one? Tunic media. Tunic media is thinner here. Lumen is bigger here, and this has the valve. Arteries doesn't have the valves, but veins has the valve so that it prevents the backflow of the blood, so that the blood can force and go. Once it's valve, the door is closed. Door is closed. It cannot come back to the original place. So from there, it has to practice to send it to the ultimately to the inferior or superior vena cava, or from there to the right artery. It's already told. How the veins move blood, the milking action of the muscles, like the limbs. So capillary beds, it consists of two types of vessels. It's called the vascular shunt, when the vessels directly connecting an arteriole to a venule. That is the vascular shunt, direct connection. There is no in between. And true capillaries, these are the exchange vessel. Oxygen and nutrient cause the cells, and carbon dioxide and metabolic waste products cross into the blood. So when they are doing the exchange in the bed. This one, see the simple difference. This is the vascular shunt. When the direct venule and arteriole and venule is connecting each other, there is no capillary bed. But here we have the capillaries. These are the true capillaries. Is network. So these are the capillaries, and this has sometimes also sphincter so that it can controls the in and out of the blood flow. What is aorta? It is the largest artery in the body. Question comes, largest artery in the body. Note it down. Largest. What? It leaves from the left ventricle, as we discussed so many times, of the heart. And then we have the ascending aorta, it leaves the left ventricle, then it makes a round arch to go down. It's called the arch to the left. Then it becomes thoracic aorta and travels downward through the thorax. And after thoracic region, we have the abdominal region. So then it travels up to the abdominal aorta, and then it passes through diaphragm into the abdominopelvic cavity. And then finally it branches and branches and branches, and also they form the right and left coronary arteries to serve the heart, as we discussed before. It doesn't need that much of detail. So these are all giving the different branches to the different organs. When it's coming to the kidney, it's called the renal artery. When it's giving the gonads, it's giving the ovarian arteries. When it's giving to the testis, is the testicular artery. When it's going to the lumbar support in the vertebral column, lumbar artery. So these are the things. System arteries. So now the venous system, superior and inferior vena cava. I already mentioned you where it stays is collecting all the deoxygenated blood, and is the collection center of the deoxygenated blood from the upper part and down part of the body. Superior is from the upper part and inferior is from the lower part. Then the superior and inferior vena cava dumps their blood into the right atrium of the heart. That is the superior vena cava. I told you it's the upper part, head and arms, and inferior vena cava is the lower body. This is the superior vena cava, left and right, and this is the inferior vena cava. So the veins draining blood from the superior vena cava, radius ulnar vein, uterus. This is important. What is the longest vein in the body? Longest vein in the body. Great saphenous vein. This comes. So who does the arterial supply of the brain? Like we learned about who supply the, like we already know that the aorta, it generates from the aorta all the blood arteries supply the blood into the different organs and tissues, like even including the heart, is called the cardiac circulatory system. Now, which serves the supply to the brain? We have carotid arteries. The internal carotid arteries divided into anterior. That's all. The carotid arteries supply the blood of the brain. You doesn't need to know much more than that. Okay. So cerebral or carotid artery. The name in the cerebral carotid arteries supply the blood into the brain. Just write it down. So what is the circle of Willis? So anterior and posterior blood supply are united by the communicating arterial branches. This is called the circle of Willis. Complete circle of connecting blood vessels called cerebral arterial cycle or cycle of Willis, because it's supplying the blood and then they are connecting each other to make a circle. That is the name of the circle. Why they gave the name of the circle? Maybe to locate the position or something. That is called the circle of Willis. Sorry. See how is connecting? The carotid artery is coming anterior, posterior. So there are different types of internal carotid artery. There are different types of, these are the different lobes of the brain. These are the, and this is called the circle of Willis. Is making a round so that all the blood vessels are connected each other. This one. There are different names of the arteries which supplying the blood to the different parts of the brain. What is the fetal circulation? Fetal receives exchange of gases and nutrients from the placenta, right? So everything is getting from the mom through the placenta. All the nutrients of the mom eats, baby eats. If the mom feels gas, baby feels gas. If the mom feels tired, baby feels tired. So everything on the mom. Okay. What is the umbilical cord? The connection between the mom and the baby. So umbilical cord contains 3 vessels. It's called the umbilical vein. Carries blood rich in nutrients and oxygen to the fetus. Here, umbilical arteries carry carbon dioxide and debris-laden fluid to the fetus, to the placenta. This is also just opposite, like all the veins generally except the pulmonary vein, it carries the oxygen, but only the pulmonary vein and the umbilical vein carries blood rich in nutrients and oxygen to the fetus, just opposite. Instead of carrying the deoxygenated one, the umbilical vein also carries the oxygen and nutrients rich blood to the fetus from the mom, and from the fetus the umbilical artery, they are originating and they are bringing back the what is called arteries is debris and carbon dioxide loaded blood. This is the fetal circulation. Okay, so there is ductus venosus. What is this one? There is a fossa ovalis. What is this one? During fetal development, the blood does flow bypass the liver because liver is not that mature again enough. So that's why what they have to do, they have to bypass the liver. So blood flow bypass the liver through the ductus venosus and enters the inferior vena cava directly to the right atrium of the heart. So blood enters the right atrium, shunt directly into the left atrium through the foramen of ovale. This is the foramen of ovale. When this become slowly you become elder, this become closed. But at the beginning, that is the hole stay in between the left atrium to the foramen of ovale. What is ductus arteriosus? Connects the aorta and the pulmonary trunk and becomes ligamentum arteriosum at birth. So these are the common things. It may come as a question. What is the foramen of ovale? Sorry, foramen of ovale, and what is the ductus arteriosus? So this is the structure again, the same structure. So which the hepatic portal circulation, digestive system, spleen, pancreas, these are not going to come. What is pulse? Pulse is the wave of blood, how the blood is passing. And that from the pulse, we can get the heart rate. So monitored at pressure points in arteries where pulse is easily palpated. So pulse average is 70 to 60 beats per minute in the adult. But fetal rate and blood rate is high, very high, 140, 160, sometimes 2 ticks. So what is when the blood pressure? Measurement by health professionals are made on the pressure in the large arteries. Systolic pressure at the peak of the ventricular contraction. When your ventricle is contracted, is giving the systolic pressure. And diastolic pressure, when the ventricle is relaxed, is called the ventricular pressure. When systolic pressure first and diastolic last. So whenever this systolic, we are going to write first. That is the pressure at the peak of the ventricular contraction. That is the 120 in normal. And then that is the diastolic, when the pressure ventricle relax, is called the diastolic and is written next. So 120 by 80, that means systolic versus diastolic pressure. And blood pressure decreases as it go away from the heart. So obviously blood pressure is more near the heart, near your chest, near your brain. But when it's going to your leg or thumb or head, blood pressure is getting reduced. So BP is blood pressure. Another name of blood pressure is BP. So BP is affected by age, weight, time of the day, exercise, body position, emotional state in natural. If there is a heart problem and other things, that is a disease condition. So CO, that is the cardiac output. We already told cardiac output is the amount of blood pumped out of the ventricle, left ventricle per minute. PR is the peripheral resistance, or the amount of friction blood encounters as it flows through the vessels. So that is the PR. So narrowing, PR is peripheral resistance, we already told. So narrowing of the blood vessels and increased blood volume increases PR, because narrowing of blood vessels will increase the blood pressure. So obviously it is going to improve or increase the blood pressure. So BP is equal to card output or the PR or the heart HR. So blood pressure is controlled by two factors: neural factors, that is which from the autonomic nervous system, and the renal factors, which is regulated by the kidney hormones. That's the renin. Temperature, heat has a vasodilating effect, cold has a vasoconstricting effect. So when you cold, your bodies become shrink, so that is the vasoconstriction, and when heat, you have a vasodilating effect. Some chemicals are dialed, some diets are there which can cause the different dilation and shrinking. So this gives a chart where you can see the each organ when it may have problem, and then how it's going to do that and how it's going to prove it. So variation in the blood pressure. Normal human range is 120 to 120 mmHg is the systolic. That is the systolic 120 normal. Even one up to 140 to 100. 120 is the best, but it can go from 110 to 140. And same thing, diastolic is 80 to 75. Hypotension, when the low systolic below 110 milligram. That is the hypotension. Hypertension, high systolic over 140. That is the hypertension. So when there is a systolic pattern is low, is below 110 millimeter, is called the hypotension. And when it's high than 140, is called the hypertension. What are the things getting exchanged in the capillary network? Oxygen and nutrients. It leaves the blood, goes to the tissue, and from the tissue or the cells, carbon dioxide and other waste leaves the cell. Seen generally is by simple diffusion across the plasma membrane. This exchange takes place. Sometimes we already learned endocytosis, exocytosis. This also happens. And some capillaries have some gaps in between. That's why you have, remember, plasma membrane not joined by tight junction. That is, they have the gap junctions. And some capillaries has pores. These are not that important to remember. That's I just told you so that you guys can get the interest and find what is going on. So these are the diagram. So blood pressure, force liquid and solute out of the capillaries, and osmotic pressure draws the fluid in the capillaries. No need. So what are the aging problems related to the cardiovascular system? Sometimes venous valves weaken. So when there is a, you feel when the venous valve weaken, so you can see the blood variation in the blood pressure. Varicose veins, you develop the very spidery veins called the varicose vein. Progressive atherosclerosis, deposition or the blocking of the arteries due to the fat deposition. Loss of elasticity of vessels lead to hypertension because the elasticity of the connective tissue outside the structure, it become loosened. So then what happened? The blood cannot flows properly. So blood stays in the vessel and giving the pressure. Coronary artery disease result from the vessels filled with the fatty calcified deposits. That's the coronary artery block. So this cardiovascular system is done. Okay. 11:52. Hold on.
So I look up at the stars to guide me and throw caution to every.
Your heart, that throbbing, beating muscle, is probably the most iconic organ in your body. No other organ gets its own holiday or as much radio play, and you're unlikely to get a love note decorated with a kidney or a spleen or even a brain, which is really what rules the emotions. Don't get me wrong, the heart does some great things. Namely, it powers the entire circulatory system, transporting nutrients, oxygen, waste, heat, hormones, and immune cells throughout the body over and over. But in the end, the heart does not make you love. It doesn't break apart if you get dumped by your boo. And and it's not a lonely hunter. The truth is, the heart is really just a pump, a big, wet, muscly brute of a pump. And it doesn't care about poetry or chocolate or why you're crying. The heart has only one concern: maintaining pressure. If you've ever squeezed the trigger on a squirt gun or opened a can of shaken soda, you've seen how fluids flow from areas of high pressure, like inside the gun or the can, to areas of low pressure, like outside. The heart's entire purpose is to maintain that same kind of pressure gradient by generating high hydrostatic pressure to pump blood out of the heart while also creating low pressure to bring it back in. That gradient of force is what we mean when we talk about blood pressure. It's basically a measure of the amount of strain your arteries feel as your heart moves your blood around. More than 5 liters of it at about 60 beats per minute. That's about 100,000 beats a day, 35 million a year, 2 to 3 billion heartbeats in a lifetime. The basic physiology of which you can easily feel just by taking your own pulse. I don't have a watch. Now that might not inspire so much poetry, but it turns out it's still a pretty good story. Let us begin with a little anatomy. Unless you happen to be of the Grinch persuasion, the average adult human heart is about the size of 2 fists clasped together. One of the few bits of trivia you often hear about human anatomy that is actually true. The heart is hollow, vaguely cone-shaped, and weighs only about 250 to 350 grams, a pretty modest size for your body's greatest workhorse. And although Americans tend to put their right hand over their left breast while pledging allegiance, the heart is actually situated pretty much in the center of your chest, snuggled in the mediastinum cavity between your lungs. It sits at an angle, though, with one end pointing inferiorly toward the left hip and the other toward the right shoulder, so most of its mass rests just a little bit left of the mid-sternal line. The heart is nestled in a double-walled sac called the pericardium. The tough outer layer, or fibrous pericardium, is made of dense connective tissue and helps protect the heart while anchoring it to some of the surrounding structures, so it doesn't like bounce all over the place while it's beating. Meanwhile, the inner serous pericardium consists of an inner visceral layer, or epicardium, which is actually part of the heart wall, and an outer parietal layer. These two layers are separated by a thick film of fluid that acts like a natural lubricant, providing a slippery environment for the heart to move around in so it doesn't create friction as it beats. The wall of the heart itself is made of yet more layers, 3 of them. That epicardium on the outside, the myocardium in the middle, which is mainly composed of cardiac muscle tissue that does all the work of contracting, and the innermost endocardium, a thin white layer of squamous epithelial tissue. Deeper inside, the heart has a whole lot of moving pieces that I'm not going to pick apart here, because the really big thing to understand is how the general system of chambers and valves and veins and arteries all work together to circulate blood around your body. Of course, fluid likes to move from areas of high pressure to areas of low pressure, and the heart creates those pressures. Form, once again, following function. Your heart is divided laterally into 2 sides by a thin inner partition called the septum. This division creates 4 chambers, 2 superior atria, which are the low pressure areas, and 2 inferior ventricles that produce the high pressures. Each chamber has a corresponding valve, which acts like a bouncer at a club at closing time, like he'll let you out, but not back in. When a valve opens, blood flows in one direction into the next chamber, and when it closes, that's it. No blood can just flow back into the chamber it just left. So if you put your ear against someone's chest, and yeah, ask for permission first, you'll hear that lub-dub. Lub-dub. What you're really hearing are the person's heart valves opening and closing. It's a relatively simple but quite elegant setup, really. Functionally, those atria are the receiving chambers for the blood coming back to the heart after circulating through the body. The ventricles, meanwhile, are the discharging chambers that push the blood back out of the heart. As a result, the atria are pretty thin-walled because the blood flows back into the heart under low pressure, and all those atria have to do is push it down into the relaxed ventricles, which doesn't take a whole lot of effort. The ventricles are beastly by comparison. They're the true pumps of the heart, and they need big, strong walls to shoot blood back out of the heart with every contraction. And the whole thing is connected to the rest of your circulatory system by way of arteries and veins. We'll go into a whole lot more detail about these later, but the thing to remember first, if you don't already remember it, is that arteries carry blood away from the heart, and veins carry it back toward the heart. To differentiate the two, anatomy diagrams typically depict arteries in red, while veins are drawn in blue, which incidentally is part of what has led to the common misconception that your blood is actually blue at some point, but it isn't. It is always red. It's just a brighter red when there's oxygen in it. So let's look at how all this comes together, starting with a big burst of blood flowing out of your heart. The right ventricle pumps blood through the pulmonary semilunar valve into the pulmonary trunk, which is just a big vessel that splits to form the left and right pulmonary arteries. From there, and this is the only time in your body where deoxygenated blood goes through an artery, the blood goes straight through the pulmonary artery into the lungs where it can pick up oxygen. It finds its way into very small small, thin-walled capillaries, which allow materials to move in and out of the bloodstream. In the case of the lungs, oxygen moves in and carbon dioxide moves out. The blood then circles back to the heart by way of 4 pulmonary veins, where it keeps moving to the area of lowest pressure, because that is what fluids do, and in this case, that's the inside of the relaxed left atrium. Then the atrium contracts, which increases the pressure, so the blood passes down through the mitral valve into the left ventricle. So the thing that just happened here, where a wave of blood was pumped from the right ventricle to the lungs and then followed the lowest pressure back to the left atrium, there's a name for that. It is the pulmonary circulation loop. It's how your blood unloads its burden of carbon dioxide into the lungs and trades it in for a batch of fresh oxygen. It's short, it's simple, at least in the way I have time to describe it, and it's just delightfully effective. Of all the substances you need to continue existing, oxygen is the most urgent, the one without which you will die in minutes instead of hours or days or weeks. But it's pretty useless unless the oxygen can actually reach your cells, and that hasn't happened yet. For that, your newly oxygenated blood needs to travel through the rest of your organ systems and share the wealth. And that fantastic journey, known as the systemic loop, begins in the left ventricle when it flexes to increase pressure. Now, the blood would like to flow into the nice low-pressure left atrium where it just came from, but the mitral valve slams shut, forcing it through the aortic semilunar valve into your body's largest artery, nearly as big around as a garden hose, the aorta, which sends it to the rest of your body. And after all your various greedy muscles and neurons and organs and the heart itself have had their oxygen feast at the capillary bed buffet, that now oxygen-poor blood loops back to the heart, entering through the big superior and inferior vena cava veins straight into the right atrium. And when the right atrium contracts, the blood passes through the tricuspid valve into the relaxed right ventricle and right back to where we started. This whole double loop cycle plays out like a giant figure eight, heart to lung to heart to body to heart again, and runs off that constant high pressure, low pressure gradient exchange regulated by the heart valves. So the first lub that you hear in that lub-dub is made by the mitral and tricuspid valves closing. And they do that because your ventricles contract to build up pressure and pump blood out of the heart. This high pressure caused by ventricular contraction is called systole. Now, the dub sound. And just to be clear, I'm not talking about dubstep sounds. That's the aortic and pulmonary semilunar valves closing at the start of diastole. That's when the ventricles relax to receive the next volume of blood from the atria. When those valves close, the high pressure blood that's leaving the heart tries to rush back in, but runs into the valves. So you know when you get your blood pressure measured and the nurse gives you 2 numbers, like 120/80. The first number is your systolic blood pressure, essentially the peak pressure produced by the contracting ventricles that push blood out to all your tissues. The second reading is your diastolic blood pressure, which is the pressure in your arteries when the ventricles are relaxed. These 2 numbers give your nurse a sense of how your arteries and ventricles are doing when they're experiencing both high pressure, the systolic, and low pressure, the diastolic. So if your systolic blood pressure is too low, that could mean that, say, the volume of your blood is too low, like maybe you've lost a lot of blood or you're dehydrated. And if your diastolic is too high, that could mean that your blood pressure is high even when it's supposed to be lower. Considering how much we've talked about the importance of homeostasis, it should come as no surprise that blood pressure that's too high or too low, or anything that affects your blood's ability to move oxygen around, can be dangerous. Prolonged high blood pressure can damage arterial walls, mess with your circulation, and ultimately endanger your heart, your lungs, brain, kidneys, and nearly every part of you. So I guess you could say that the best way to break a heart is to mess with its pressure. But good luck trying to write a song about that. Today you learned how the heart's ventricles, atria, and valves create a pump that maintains both high and low pressure to circulate blood from the heart to the body through your arteries and bring it back to the heart through your veins. We also talked about what systolic and diastolic blood pressure are and how they're measured. Thanks to our headmaster of learning, Thomas Frank, and to all of our
Oh, this one I did.
Eliminate unsigned important documents with SignNow.com, an easy-to-use e-signature solution that grows with your marketing use cases.
Did you did this one?
SignNow allows us to sign reports, invoices, and contracts faster. I can send documents for signing to multiple recipients at once.
Don't take this the wrong way, but you're pretty replaceable. When it comes to your body, science has figured out how to hack, synthesize, or replace a surprising amount of its parts and processes. We have implants to keep heartbeats steady and steel rods to mend bones. We've got drugs that can replace hormones and antibiotics to cover for your immune system. And pretty soon you'll be able to just
circulatory system, the blood. And this is the video after it. There is a second video from that heart cardiovascular system. There is part 1 and part 2. Is the part 2 we have to watch now.
Yeah, we did complete the total circulatory system. I did it.
Yeah, there are 2 videos after the PowerPoint. We watched one. Is the second one you have to play now.
This one? You already
Not this
watched?
one.
Which one? Okay.
You have to go back to the
Okay,
circulatory
okay,
system.
okay,
You
okay,
see
okay.
2
Sorry,
videos.
sorry,
Yeah,
sorry,
this one
sorry,
is
sorry.
blood.
This one?
This
No,
one is blood. We are not
okay,
yet we've not
okay,
yet covered blood.
okay. Just, but this is we didn't do the blood. We did that whole system, right? But
Circulatory system.
yeah, we did. What is that unit?
It's
This
up after now.
integumentary up.
Lymphatic,
So this one
immune.
12. Okay.
Yeah.
Okay. So we did this one, right? I did
Yeah.
already. I
The
played this
first
one.
one.
Now this is the
Part
second
2.
one.
Yes.
You have to play this one, right?
Mm-hmm.
Right? Okay.
Contribute to some misconceptions about how defibrillators, CPR, and the electricity of the heart work. Because the truth is, CPR can help prolong heart function during cardiac arrest, but it usually can't save a life without help from a defibrillator. And when McDreamy, may he rest in peace, finally bursts out those paddles, that high voltage shock isn't turning the heart back on. It's actually stopping it. Confused? Well, I'm here to get your head to understand your heart. We'll get back to hot TV doctors in a couple of minutes, I promise. But in order to understand what's actually going on during cardiac arrest, we have to understand some basics about your heart cells. We've learned a lot about skeletal muscle tissue, how it's striated and contracts using the actin-myosin sliding filament dance you've heard so much about. Your cardiac muscle is also striated and uses sliding filaments to contract, but the similarities end there. For one, their cells look pretty different. Skeletal muscle tissue has long multinucleate cells, while cardiac cells are squat, branched out, and interconnected, each one with 1 or 2 central nuclei. The cells are separated by a loose matrix of connective tissue called the endomysium, which is chock full of capillaries to serve up a constant supply of oxygen. Cardiac cells are also loaded with energy-generating mitochondria. In fact, mitochondria take up as much as 25 to 35% of each cell, making it resistant to fatigue, which is partly why your heart can beat nearly 3 billion times in a lifetime. Not surprisingly, the differences between skeletal and cardiac muscle tissues are key to understanding their functions. Skeletal muscle fibers are both structurally and functionally separate from each other, meaning that some cells can work while others don't. That's why you can grasp a delicate flower with the same hand that you can use to crush a soda can. Cardiac cells, on the other hand, are both physically and electrically connected all of the time. It takes precise coordination to create the high and low pressures required to pump your blood, after all, and cardiac cells need to be linked in order to have that perfect timing. And there's one more thing you need to know about your heart cells. Some of them can generate their own electricity. How in the name of Raymond de Vousons can that be? Well, rewind your brain to when we explored the electrical marvel that is the action potential and how it triggers both neurons and muscle cells. That process started by depolarizing the cell, that is, pushing the cell's membrane potential from negative toward positive past a threshold that triggered voltage-gated ion channels to open. Most cells in your body only depolarize after being triggered by an external stimulus or by a neighboring cell in a long chain reaction of action potentials that's set off by the nervous system. But that is not the case for a special group of cells found only in your heart, ones that can trigger their own depolarization. These are your pacemaker cells. Pacemaker cells are what keep your heart beating at the correct rhythm and ensure that each cardiac muscle cell contracts in coordination with the others, because you don't want your brain to have to send a series of action potentials every time you need your heart to beat. Your brain has got other stuff to do. So pacemaker cells are, in a way, your heart's very own brain, generating the initial spark that sends a current through your heart's internal wiring system, known as the intrinsic cardiac conduction system. This system transmits electricity along a precisely timed pathway that ends with atrial and ventricular contractions, also known as heartbeats. And it begins with pacemaker cells generating their own action potentials. In most cells, the action potential starts with the resting potential, which the cell maintains by pumping sodium ions out and potassium ions in, right? Then, when some stimulus causes the sodium channels to open up, the sodium ions flood back in, which raises the membrane potential until it reaches its threshold. Pacemaker cells cells operate the same way, except for that initial stimulus. They don't need it. Their membranes are dotted with leaky sodium and potassium channels that don't require any external triggers. Instead, as their channels let sodium ions trickle in, they cause the membrane potential to slowly and inevitably drift toward its threshold. Since the leaking happens at a steady rate, the cells fire off action potentials like clockwork, and the leakier the membrane gets, the faster it triggers action potentials. The pacemaker cells at the start of the conduction system have the leakiest membranes, and therefore the fastest inherent rhythms, so they control the rate of the entire heart. And those fast leaky cells are found in the sinoatrial node, or the SA node, up in the right atria. They essentially turn the whole SA node into your natural pacemaker. After those pacemaker cells make themselves fire, they spread their electrical impulses to cardiac muscle cells throughout the atria. The impulses leap across synapse-like connections between the cells called gap junctions and continue down the conduction system until they reach the atrioventricular node, or AV node, located just above the tricuspid valve. Now, when the signal hits the AV node, it actually gets delayed for like a tenth of a second, so the atria can finish contracting before the ventricles contract. Without that delay, all the chambers would squeeze at once, and the blood would just splash around and not go anywhere. So instead, the atria contract and blood drops down into the ventricles, and then a moment later, the signal moves on and triggers the ventricles to squeeze, making the blood flow out of the heart. And there are two tricks to a good ventricular contraction. One, the ventricles are so large that the signal has to be distributed evenly to ensure a coordinated contraction. And two, the ventricles need to squeeze like they're squeezing a tube of toothpaste from the bottom up to accelerate the blood through the big arteries at the top of the heart. So from the AV node, the signal travels straight down to the inferior end of the heart and gets distributed to both sides. The path the electrical impulse takes to the bottom of the heart is called the atrioventricular bundle, also known by the more rad name the bundle of His, where it branches out to the left and right ventricles. Finally, the signal disperses out into Purkinje fibers, which trigger depolarization in all surrounding cells, causing the ventricles to contract from the bottom up like toothpaste tubes, at which point the whole cycle starts all over again. And everything I just described to you, from when the SA node fires to when the last of the ventricular cells contract, takes about 220 milliseconds. So that is how your heart beats. But I know what you want. You want to get back to talking about TV shows and McDreamy and his paddles. It's totally understandable. Okay, so picture all your individual heart cells as a bunch of musicians in an orchestra. They all sound really great together, but then the conductor suddenly needs to go to the bathroom. And it sounds okay at first, but then the tuba gets a little weird and the triangles half a beat off, and soon everyone is playing a different note at a different time, jamming to their own personal rhythm. In the heart, we call this out-of-sync behavior fibrillation, and it can be caused by all sorts of problems, especially ones that affect the pacemaker cells in the SA node. In an orchestra, this just sounds really terrible. In a heart, there's no coordinated contraction, no lub-dub, no blood moving through the body, which means you will soon be dead. But then the conductor comes back from the bathroom break, taps her wand, and everybody stops. It's silent for a second before the wand comes up, and then they all start playing again, this time in unison. If your heart in fibrillation is an out-of-sync orchestra, then a defibrillator is that conductor. It stops the chaotic noise by overriding all the individuals and hits a sort of reset button, so everyone can start again on the same page. The paddles send so much electricity through the heart that they trigger action potentials in all of the cells at once. Then the cells repolarize and start leaking again, and the most leaky cells in the pacemaker SA node reach their threshold and fire first, resetting the rhythm that keeps everyone in harmony so your heart functions properly. And that is how hot doctors and their paddles actually stop hearts to save lives. Now, the thing about CPR, or cardiopulmonary resuscitation, is that it can't correct fibrillation. What those chest compressions can do is force a fibrillating heart to keep circulating oxygenated blood until help arrives. But if a person is in cardiac arrest, just breathing into their mouth and compressing their chest won't deliver the electricity needed to give the pacemaking cells a chance to reset. I think I just figured out why they call those TV doctors heartthrobs. It's a terrible joke. Anyway, today you learned how your heart's pacemaker cells use leaky membranes to generate their own action potentials and how the resulting electricity travels through the cardiac conduction pathway from SA node to Purkinje fibers, allowing your heart to contract. And if you weren't too busy daydreaming about TV doctors, you also learned how defibrillators work to reset the rhythm of your heart. Thank you to our headmaster of learning, Thomas Frank, and to all of our Patreon patrons who helped make Crash Course possible.
So don't scared about all the repolarization, sodium, potassium in and out. Just make sure how the SA to AV to bundle up his bundle branches, the Purkinje fibers works. That is the main thing. We are going to learn it again. The same thing, how is related to the ECG. We are going to learn it again. So remember this one. This is good. This is the how the Heart generates its own electricity and function properly to do the pumping in and out for the receiving and delivering the oxygen, deoxygenated and oxygenated bloods. Okay, so the last one now. Who is coming to the terminology whenever I go? Now it's going to the blood vessels, okay? There is no chapter 10. Chapter 10 blood. Okay, so now this one. Oh, this is the another one. Okay, how many? Okay, let me see chapter blood. 63. You can come do that one tomorrow. Blood. Okay, so let me do that. PowerPoint 10. Today 9, 10, 11, 12. Cardiovascular system. Okay, so okay.
Over 500,000 people are living with dementia in Canada today, with increased.
Blood vessels are another great example of how anatomy and physiology go together like peanut butter and jelly. How they look and what they do go hand in hand. Most of your blood vessels share a similar structure consisting of 3 layers of tissue surrounding the open space or lumen that actually holds the blood. Anatomists call these layers tunics, and the innermost section is called the tunica intima, which should be pretty easy to remember because, you know, it's like has intimate contact with the lumen. It's like your circulatory underpants. The cool thing about this layer is that it contains the endothelium, which you may remember is made up of simple squamous epithelium tissue and is continuous with the lining of the heart. These cells form a slick surface that helps the blood move without friction. Surrounding the tunica intima is the middle layer, the tunica media, which is made of smooth muscle cells and sheets of the protein elastin. That smooth muscle tissue is regulated in part by the nerve fibers of the autonomic nervous system, which can decrease the diameter of the lumen by contracting this middle layer during vasoconstriction or expand it by relaxing during vasodilation. That right there should tell you that the tunica media plays a key role in blood flow and blood pressure, because the smaller the diameter of the blood vessel, the harder it is for blood to move through it. Kind of like trying to drink milk through a cocktail straw versus a soda straw. And finally, the outermost layer of your blood vessels is the tunica externa. It's like an overcoat if that coat were made mostly of loosely woven collagen fiber. Actually, if your coat happens to be made of leather, it is made of collagen, and like a coat, this outer layer is what protects and reinforces the whole blood vessel. Now, the ratio of the thicknesses of these 3 layers varies between blood vessels of different types, because guess what? Yes, form follows function. Let's take a look. Say you're gearing up for a big tournament of thumb wrestling, or what has been called the miniature golf of martial arts. How does blood move through your systemic circulatory loop to get from your heart to your champion right thumb flexing muscle, the flexor pollicis brevis, and back again? Well, you will remember from our lessons on the heart that blood leaves the left ventricle through the aorta, the biggest and toughest artery in your body, roughly the diameter of a garden hose. The aorta and its major branches are elastic arteries. They contain more elastin than any other blood vessel type, so they can absorb the large pressure fluctuations as blood leaves the heart. What's more, that elasticity actually dampens that pressure so that big surges don't reach the smaller vessels where they could cause damage. This is really where that whole pipe analogy falls apart. These arteries are really more like balloons. Their pressure reservoir is able to expand and recoil with every heartbeat. If they were rigid like pipes, they'd eventually leak or burst after being battered by so many waves of pressure. So that blood leaves your aorta, and since it's heading to your thumb, it travels along the elastic subclavian artery, which gives way to a series of muscular arteries, in this case the brachial artery in your upper arm and the radial artery in the lower arm. Muscular arteries distribute blood to specific body parts and account for most of your named arteries. They're less elastic and more muscular. These arteries invest in additional smooth muscle tissue and proportionally have the thickest tunica media of any blood vessel. This allows them to contract or relax through vasoconstriction and vasodilation vasodilation, which we've talked about a lot in terms of the nervous system's stress response. These arteries keep tapering down until they turn into the nearly microscopic arterioles that feed into the smallest of your blood vessels, your tiny, extremely thin-walled capillaries, which serve as a sort of exchange or bridge between your arterial and venous systems. They may be little, but your capillaries are where the big important exchange of materials actually happens. Capillary walls are made of just a single layer of epithelial tissue, which form only the tunica intima, so they're able to deliver oxygen and other nutrients in your blood to their cellular destinations through diffusion. The capillaries are also where those cells can dump their carbon dioxide and other waste back into the blood and send it away, through the veins to the lungs and kidneys, but we'll come back to that in a second. Unlike arteries and veins, capillaries don't operate on their own, but rather form interweaving groups called capillary beds. Besides exchanging nutrients and gases, your capillary beds also help regulate blood pressure and play a role in thermoregulation. Say you're in the room where you're practicing your thumb calisthenics, which probably isn't the thing, but the room is a little chilly, so the blood feeding your dermis loses a lot of heat to that cold air. Well, smooth muscle forms tiny sphincters, yeah, you got sphincters everywhere, around the vessels that lead to each of your capillary beds. When they tighten up, they force blood to bypass some of those capillaries, which means less blood is exposed to the cold and you lose less heat. If it's really cold, the smooth muscles around your larger arterioles and muscular arteries, like that radial artery in your lower arm, will also squeeze, slowing blood flow to your whole hand, which is no way to win at thumb wrestling. But it's one reason why your fingers get all stiff and numb in the cold. They're not getting as much warm blood because your blood vessels are trying to conserve heat. Conversely, if your thumb is working really hard and producing heat from all that exertion, those capillary sphincters relax and open wide, flooding the capillary bed with blood to help disperse heat, which is part of the reason that you might get red-faced when you're hot or exercising hard. So anyway, now your thumb muscles have just feasted on a batch of oxygen and glucose served up on a fresh bed of capillary, and they're ready to take out the trash. The cells send their CO2 and other junk out to the venal end of the capillary exchange, where the capillaries unite into venules and then merge into veins that head back to the heart. Remember that the pressure in these vessels has to be dropping, since fluids always flow from higher to lower pressure. But since the pressure is so low in your veins, it's like 1/12 of the pressure in your arteries, there isn't much pressure gradient left to push the blood back to your heart. So veins require some extra adaptations to keep the blood moving in the right direction. That's why some of them, especially veins in the arms and legs that have to work against gravity, have venous valves that help keep the blood from flowing backward. If those valves leak or a vein experiences too much pressure, the backflow of blood can stretch and twist the vein, leaving you with varicose veins, or if this happens in another part of the body, hemorrhoids. But anyway, we've gotten pretty far from your thumb at this point. We got a loop to finish here. From the capillaries and venules in your thumb, that low-pressure blood flows from the radial vein to the brachial vein to the subclavian vein, where it dumps into the superior vena cava and settles for a second in the right atria before dropping into the right ventricle. From there, it's sent to the lungs, where it gets oxygenated and then comes back into the left atria before sliding down into the left ventricle, where it builds up pressure again and spurts back out into your aorta. It takes about a minute for all the blood in your body to complete that circuit, which means even if you're mostly at rest, your hard-working circulatory system moves about 7,500 liters of blood through your heart every day. Just in the time that you've been sitting there listening to me, probably about 52 liters has coursed through. So yes, much like the internet, your blood vessels are more than just a series of tubes. During the time that you've been circulating all that blood, you learned about the basic 3-layer structure of your blood vessels, how those structures differ slightly in different types of vessels, and you followed the flow of blood from your heart to capillaries in your right thumb and all the way back to your heart again. If you like Crash Course and you want to help us keep making videos like this, you can go to patreon.com/Crash Course. Also, a big thank you to Matthew Pierce for co-sponsoring this episode of Crash Course Anatomy and Physiology.
So we have completed these two. Tomorrow we are going to start with the blood. Okay. And I have to go to another meeting now. So you guys can do your study as you do. And then around 1, you can leave. Okay.
Okay, thank you.
Okay, thank you.
Thank you.
Yeah. So try to read. This is going to for continuously this cardiovascular system and all the blood is going to be throughout your life as you are in the process, because these nodes electrical things generation is linked with your ECG, and obviously the blood we are going to do tomorrow again, that is going to more, but it's very interesting to know how the body function, how the heart function, how the blood, can you imagine how much blood is pumping out per stroke? Forget about that per minute. My goodness. How we are know the blood pressure, but what is the blood pressure? What is the you are seeing the loved up sounds? Don't about the polarization, depolarization, all these things, how is coming out, the in and out of the membrane. That is little bit complicated for you guys. But yeah, obviously in the video it's interesting to know, but it's not going to be come in your questions, that I can tell you. But do the study. So then maybe I'll be another meeting. I may not be with you for now, but stay in the team one, and then you can leave. And see you tomorrow then. Okay.
Okay, see you tomorrow.
Okay, Miss.
Okay.
See you tomorrow.
Okay. 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 Stop sharing. Don't. No one leave. Okay. Okay. Thank you. I'll not be able to talk, but I can back and forth and see you guys. Okay. See you.